My name is Rick Brown. I'm the director of the UCLA Center for Health Policy Research, and I want to welcome you to this event with Congressperson, Congressmember Karen Bass, the Honorable Karen Bass. This is a talk that Congressmember Bass has agreed to do to help inform us about the critical policy issues in Washington, D.C., in the U.S. Congress that will affect everything we do here at UCLA. It'll affect education, and in this area of the campus, it will affect everything we do in the health sciences, from research to the Medicare program and funding of services and graduate medical education, and of course, access to care for Medicare beneficiaries. It will affect low-income people who depend, in many cases, on Medicaid funding, which in California we call Medi-Cal. And it affects every program that we have at UCLA. Karen Bass was elected last November to represent the 33rd Congressional District in the House of Representatives. And as soon as she got to Washington, Speaker Nancy Pelosi recognized her extraordinary leadership abilities and selected her to serve on the prestigious Steering and Policy Committee for the Democratic Caucus, which sets the policy direction for the caucus. She was also named to the powerful House Budget Committee, not an assignment she sought after so many years in leading California's budget conflicts, but one that she willingly took on at the request of the Speaker. Prior to her election to the House, Karen Bass served as the Speaker of the California Assembly. She's the first African-American woman in the United States to serve in this powerful state legislative role. And so she has broken many barriers and achieved many tremendous victories in her life already, and one of them is representing her district in the Congress. She's a lifelong Angelino who was trained as a physician assistant at USC and worked there in the trauma center. In 1990, in response to the crack cocaine epidemic in South Los Angeles, she organized and founded the Community Coalition, which used a public health approach to fighting substance addiction and other social problems in that community. And by a public health approach, I mean that she formed a coalition of public health agencies, social welfare agencies, community-based organizations and agencies, faith organizations, and law enforcement and probation to address this issue in a unified way. She and the coalition engaged in many activities to try to turn the community around and was very successful in reducing the number of liquor stores in that community that had a higher density of liquor stores than any place else in California and more than many states in our country. She continues to be an advocate for foster children, and she has carried several bills and led successful fights for legislation in California to change policy and make it a more supportive system for foster youth. And she is now leading a similar effort in the U.S. Congress. Karen Bass is an unabashed advocate for UCLA, even though she attended the school on the other side of town. She estimates that probably 30% of the staff at the Community Coalition, the organization she founded, are UCLA graduates, Bruins. She attributes that to what she calls, and this is a quote, powerful dedication to positive change, not superficial or incremental, but real transformational change. It's made the science, UCLA has made the fine science of public service by identifying leaders, feeding them insights, fine-tuning curriculum, and training them to be effective from day one. She was appointed a senior fellow in the UCLA School of Public Affairs in 1998, and it is a great pleasure to introduce and welcome Karen Bass.
Thank you. Thank you. Thank you. Good afternoon, everyone. It really is my pleasure to be here at UCLA, and I think I try to come here at least once a year. And in the 6 years that I was in the state legislature, I did represent UCLA, and now in Congress, I represent that other school. But you know, UCLA will definitely always be in my heart, and the school knows it can call on me at any time. I especially want to thank Dr. Brown, who is not only a colleague, but a long-term friend. And usually when Dr. Brown, or Rick Brown, as I know him, calls me and asks me to do something, I'm very happy to do that. So what I would like to do in these minutes that I'm with you is, one, talk for a little bit about Congress right now, but then also leave enough time for a conversation, because frankly, I always prefer the conversation and the dialogue, and hopefully the questions that you have, we can engage in a conversation about that. So I have been in Congress now for a total of 4 months. And what a 4 months it's been. You know, in the years that I served in the state legislature, the Democrats are in control. And so going to Congress, where we had a huge change, a huge turnover, the largest freshman class in recent history, with over 90 new members of Congress, and 87 of those members being Republican and 9 being Democrats. And of the 87 Republicans, with the whole wave that happened in November, a sizable number of them were elected by the Tea Party advocates in their district. And so just to, you know, describe the first 3 months, I think on the second day, the leadership decided that we should begin each day by reading the Constitution. And so there were times when different parts of the Constitution were read, and that's the way we began our day. One of the first acts of the new Congress was to repeal the Affordable Care Act. And given that the Republicans are in charge, the repeal did move and was passed out of the House, but of course we have 2 houses, and it didn't come up. Actually, it did come up. It was defeated in the Senate. So although there was a lot of talk about the repeal of health care reform, I know people in this room know that that didn't take place. The problem with that, though, is that it creates a tremendous amount of confusion with the public. And so people don't know. They hear it was repealed, they hear it was passed, they don't know if now their kids that are eligible to be on their health care until they're 26 are going to be kicked off or what. So it creates a lot of confusion. After health care, after that bill moved out of the House, the next crisis that we had to deal with was a continuing resolution of the budget. Now what that means is that in Congress, very different than the state, I would have kind of loved it if we could have done this in the state, but if you don't pass a budget, you can pass what's called a continuing resolution, which just means you keep spending the way you had been spending in the previous time you passed a budget. But this time, the Republican majority decided to attach over 200 amendments to the continuing resolution, which would have led to really, really severe cuts that actually a Republican economic analysis said that if those cuts were to move forward, it would have resulted in 700,000 jobs lost. And so if you look at the over 200 amendments that were put forward, I would say about 100 of them actually were voted on in the House. And I would say, these are estimates, 20 to 30% of those amendments gutted health care reform. So the funding that was needed to move forward the Affordable Care Act would have essentially been gutted had these amendments passed in the Senate. I would say about another 30% of the amendments gutted the Environmental Protection Agency. So would have deregulated a lot of the regulations that we have that keep our air and our water clean. And then a percentage of the amendments were directly targeted toward women with the defunding of Planned Parenthood. And you know, as people know, Planned Parenthood for a lot of women, especially younger women and women who are low income, is really their sole source of health care. And so anyway, if you divide it up, so what I'm describing then is an ideological agenda. And I think it's very important to view what is going on in our country from an analytical perspective of an agenda that is being put forward that really, if it were implemented, would call for fundamental changes in our country. And this describes a debate that's been going on in our country for years. And I would describe the debate, and it gets played out, by the way, through the budget. because a budget is really not just a collection of numbers, as people know, but it's a statement of your values and your priorities. And so the way you can fight out an ideological agenda is through a budget. And so I think the questions that are raised through the budget process is what is the role of government? Is government, well, government is seen as the enemy. I mean, you know that. Government is the problem. What the solution should be to shrink the government. We need to get the government out of people's lives. If you look below the surface, though, in a way, it's a double message, because people who push this do believe in shrinking the government in certain areas. And in other areas, they actually believe in using government resources and directing those resources toward the private sector. At one point, I was rather shocked late one night when I heard one member get up and she was talking about an amendment she was putting forward, and she was saying that we need to make these deep cuts and shrink the government so that we can turn the resources over to the corporations that create jobs. I was like, oh my, somebody didn't edit her talking points. It should have been couched a little bit. But a lot of the anti-government sentiment, and obviously I'm presenting my opinions here, but a lot of the talk about shrinking government, in my opinion, is really coded language, and it's coded language to shrink or to change or to dismantle the social contract that we've had in our country for so many decades, whether we're talking about Social Security, whether we're talking about Medicaid, or whether we're talking about Medicare. And this really is a historical battle, and you can go back to when Social Security was being talked about in our country. It was being said that was going to end civilization. I mean, if we have Social Security, every time there has been a major program like that, it's always been extremely controversial. So let me go back a bit and talk about the Affordable Care Act. So, the United States was really the only industrialized country that lacked a comprehensive system of health care for its population. A few aspects of the Affordable Care Act, really a lot of it focuses on prevention. So mothers and infants would have benefited greatly or will benefit greatly from health care reform. Infant children in the beginning with pre-existing conditions can't be denied coverage. A lot of different aspects of healthcare reform, whether it's the pre-existing conditions for adults, which comes in later, the pre-existing conditions for children, which is in place now. Children who are adults, rather, who are 23 years old can be carried on their parents' health insurance. A lot of those aspects of healthcare reform in now the budget, Paul Ryan, who's the chair of the Budget Committee, is actually talking about reversing those. So since they weren't able to outright repeal health care reform, another way at it is through the budget process to slow it down by either cutting the funding or eliminating provisions that required financial support. So the budget that is being put forward by Paul Ryan, and people, how many people have heard of the budget chairman, Paul Ryan, by now? He's become well known. Wow, everybody knows about him, huh? I'm going to tell him he's becoming famous when I see him next week. I'm on his committee. Everybody's here heard of him. But anyway, what he's calling for, essentially, if the act was repealed, we would be eliminating subsidies for low and middle income Americans, which guarantees that uninsured rates will remain high. Because again, part of healthcare reform was providing subsidies. Because it won't be affordable without the subsidies. The insurance exchanges and the standard health benefits that would be offered in the exchanges will guarantee that the individual and small group insurance markets will remain fragmented, excessively expensive, and dominated by high deductible policies that shift excessive financial risk into those who purchased it. If we did repeal it, then I already talked about the adult children. That would be reversed. It would be prohibiting health plans from imposing lifetime dollar limits on benefits. So that's a part of health care. So if that gets repealed, then we can go back to the system as it was, which means, you know, if you become too expensive for your health policy, then they just cancel it. And the other thing that the ACA did, the Affordable Care Act, was begin to close the donut hole that Medicare prescription drug policy that was put in place several years ago actually resulted in. So if it was repealed, it would reverse a lot of the protections that would be implemented in 2014. So some of what I talked about is implemented now, but in 2014, this would also happen if we were to reverse it. Prohibiting health plans from refusing coverage for adults because of pre-existing conditions, limiting the individual and family out-of-pocket spending, and prohibiting health plans from charging higher premiums for individuals with less than perfect health status. So if they're not going to eliminate you because you have a pre-existing condition, they can charge you a higher rate if they feel that your health status is not actually perfect. Just a little side note, in California, we're lucky, frankly, because we have an attorney general and an insurance commissioner. They're going to do everything they can to make sure that we can implement health care reform. So with the election of Kamala Harris and Dave Jones as the insurance commissioner, we do have two advocates. So we're very fortunate that that actually went that way. The Affordable Care Act emphasizes preventive care, including prenatal visits, which are covered under the bill. And this, you know, is significantly important for a lot of populations, specifically the African American population that has an infant mortality rate where black babies die 3 times as frequently as white babies. In Ryan's plan now, what he's calling for, he doesn't want to have any funding for the National Healthcare Workforce Commission. So a part of the Affordable Care Act called for a commission that would look at the workforce. One of the things I think actually that Democrats fell behind on in the whole debate around healthcare reform was the jobs that it was going to create. I mean, I worked in healthcare, and it's been 20 years since I've been in clinical medicine, but I know when I was directly involved in clinical medicine, we were short-staffed 20 years ago. The idea that we would expand coverage to 31 million people means that part of the workforce is really going to grow. And so this commission was needed to prepare for that. So again, the way Ryan and the Republicans are trying to get at healthcare, since they can't repeal it, is by doing things like cutting the funding for the Workforce Commission. You know, I happen to believe that the #1 issue in our country really is jobs. We are still suffering from very high unemployment. The unemployment rate in California is still at about 12%. That's extremely high unemployment. And so here are jobs, and here is an area of our economy that is going to grow. And I think that that's something that really needs to be talked about a lot. This is a solution toward the crisis. I mean, granted, people need jobs today, but looking at it short-term and long-term, working in healthcare is one of the best jobs that you can get in the future. So a lot of controversy has started over Ryan's plan, Ryan's budget, and I would just encourage you to read the document. I mean, he's written 2 documents. One is the Roadmap for America's Future. The other one is the Path to Prosperity. And the Path to Prosperity is really an articulation. I consider it an ideological document, but it's talking about his view, you know, of the budget. And so in that document, he calls for ending Medicare as we know it. He doesn't like the idea of calling it a voucher. In his first document, the Roadmap for America's Future, he calls it a voucher, but I'm sure he polled and he was told that's not a good word. So he's changed the word to premium support. And premium support is a voucher. And so, I don't quite understand the logic that he uses. I actually want to ask him when I get back, or maybe I shouldn't because he's had a real hard week. But, you know, the way he talks about it is that we're not changing Medicare for anybody that's over 55. And I think that's supposed to be okay. So I'm glad he took care of my generation, but he threw most of you under the bus, including his own generation, because Ryan's just 41. So what that says is that if you're currently 55 or older, Medicare is not going to change for you. But if you're under 55, then we're going to change this system so that when you do hit 65, we will give you a check and tell you that you can go out and purchase your health insurance. But if they were successful, because when you have to blow it out completely, if they were successful in repealing health care, then what stops insurance companies from denying people with pre-existing conditions? What if the insurance company says, I'm not going to insure you, you're 65, you have 5 conditions, why would I insure you? Or, I'll take you for a while because you don't have any conditions, but oops, you have cancer now, so we'll cover you for a year and hope you get better. There isn't anything in there that says, that has guarantees for that. What he wants to do to Medicaid is he wants to take Medicaid and put it in the form of a block grant. And there are a lot of governors that are opposed to this. 17 governors signed up and said that they don't like the idea of a block grant. But a lot of governors have said they want a block grant. And just to describe this for a minute, a block grant means that from Washington, they would give, let's just say $100 million, okay? So they would give California $100 million, and that's it. Well, right now, because it's an entitlement, the federal government gives California a certain amount of money, but that can also go up and down. So for example, we're in the worst recession since the Great Depression, or we're coming out of the worst recession since the Great Depression. When you're in a recession, your Medicaid numbers go up, or Medi-Cal as it's called in California, because why? People lose their jobs, they lose their health insurance, they need to go on Medicaid. What about in the early 80s when HIV first appeared on the scene? What about the swine flu? I mean, you could think of any kind of epidemic. There are reasons why you need to have that flexibility, and if you tie it into a block grant, then you don't have any flexibility for if circumstances change. The other thing about Medicaid is that I think that people's reaction a lot of times is, well, that's for poor people, so I don't really need to worry about poor people. But a good percentage of Medicaid, I think it's about 40%, is used for long-term care. And so Medicare does not cover a nursing home. And that's how you provide for somebody that's going to be in a nursing home. And so I'm not sure if they were thinking about this when they came up with this idea, but needless to say, they're getting a tremendous pushback with the idea of, one, turning Medicare into a voucher system, and then number 2, block granting Medicaid. I think you have to take these, when things like this happen, when these kind of proposals happen, I think it's always important to put them in a bigger context, to look at what the larger global issues are, and then to figure out how we respond to it within that context. So if there is a great debate happening in our country over what is the role of government, I think that then puts the responsibility on us to remind people who and what government is. And so the same people that want to shrink government, the rhetoric is we want to shrink government to fit it in a bathtub. I think that's what Grover Norquist says, so that it fits in a bathtub. Well, what happens when your house catches on fire? Or why you complain about the pothole that's in the street, or you get mad because the Department of Motor Vehicles is not open, on a Friday. There seems to be a need for public education around what government is, the role of government. The other thing that Ryan has done, which is rather comical, is redefined corporate welfare. So if you read his document, The Pathway to Prosperity, he defines corporate welfare as supporting companies that are trying to develop alternative energy, ending our dependence on oil. What we should in fact do is drill everywhere that it's possible to drill. If we have regulations that protect our environment, or regulations that we have, say like on the financial industry, well, that's corporate welfare, and what we need to do is roll back those regulations. So again, I don't make this up. Trust me, I don't, which is why I would encourage you to read his document. It's also interesting that if you look back during the time when Reagan was president, he actually proposed the complete, having the federal government have complete responsibility for Medicaid. You know, now the state has some responsibility as well. And Reagan also raised taxes, but it's kind of funny because they've redefined Reagan, and when I hear Reagan talked about, I'm not sure who they're talking about, because I mean, I remember him when he was governor and president, and they have completely rewritten history and raised him to the point of a deity. And but they only want to talk about part of what he did, so we don't want to talk about the fact that he raised taxes. He raised taxes in the state of California. As a matter of fact, you know, kind of funny, sometimes we would put forward a bill that we would call it the Reagan bill, and it was trying to raise taxes in the state. And my colleagues across the aisle weren't very happy with us, you know, when we did that. But anyway, I want to wrap up now and just say, you know, a couple of things. Some of the cuts that are being proposed, not just by Ryan, but also by the president, and cuts that are going to be painful. In general, the president as well as the Democrats are calling for a balanced approach, recognizing that cuts have to happen in this time period, but there needs to be a balance with revenue. And the quickest way to raise revenue is to end the Bush tax cuts. That's the quickest way. But you know, you can't just cut your way out of a crisis. And as Dr. Brown mentioned, I wasn't excited when I was given the assignment of being on the Budget Committee, especially because I had been through the budget wars of Sacramento for 6 years. But, you know, I understood why they put me in that position because, you know, I have been through this fight before. So although I might be fighting in Washington, it's the same ideological fight that takes place in Sacramento every year. And I think it's important that we view it in a bigger way that way so that it doesn't feel like we're always fighting these little skirmishes. It's actually fighting over the same issues. And I think, you know, it gives our responsibility of how we define what our values are and how we fight for those values. But having said that, there are cuts that have the potential to impact UCLA. There are cuts to the National Institute of Health that are being called, obviously on the Republican side, they're calling for much deeper cuts than the Democrats are. There's cuts to federal agencies that are the source of research and medical education funding that could potentially impact UCLA. And then I mentioned that there's cuts to support the development of the healthcare workforce. And so, you know, these are tough times that we're going through. And I think it's, you know, important, again, that even in the midst of all of these challenges, because people have asked me how I like, you know, being in D.C., especially given this environment. And I think that it's always important to look for those opportunities. I mean, obviously, I'm partisan. I'm a Democrat. I'm giving you my opinion and my perspective. But having said that, it's not a hostile environment. You have differences with people, but you look for opportunities to work together, and you recognize that the Republicans might be in leadership now, but that's liable to change. And these are colleagues that I hope to work with for many years to come. And so I don't view them as my enemies. I view them as people that I have a difference with. So let me just end on what I think is a positive note. As Dr. Brown mentioned, one area that I do work in is foster care. And foster care happens to be one of those issues, it's interesting, but you can bring Democrats and Republicans together on. And so I hope to forge a relationship with my Republican colleagues on the issue of kids in the foster care system and build those relationships toward a time when we might work together on other issues. And so with that, maybe I will open it up for questions and we could spend the rest of the time in a dialogue.
Any questions? Yes.
How do nurse practitioners play a role in this environment?
Oh, what a nice question to ask.
So the
Especially
question
since I
was
at
about
the
nurse
end.
practitioners and what role they'd play in this new environment.
Well, I was saying I appreciate the question as a former practicing physician assistant. nurse practitioners are our, colleagues, a really important role, an extremely important role. If you think of the fact that we need to expand healthcare to 31 million people, I think we need to educate the public about who are healthcare providers, because a lot of people think of doctors, nurses, and they don't think about all of the other allied health fields associated with that. So one of my areas of interest policy-wise in terms of healthcare reform is the workforce. And so the part of the workforce, though, that I think is the most important, which I'm sure the people in this room can appreciate, is financial support. And so when I went to school, I would never tell you what I paid compared to what I know you are paying now. And I think that there needs to be an increase in the public health service, the National Service Corps, so when you come out, the loans can be forgiven if work is done in underserved areas. And so even though I might not be able to make much progress in this particular Congress on that issue, that is my focus and my commitment in this area. It's going to take a while, but I do believe we'll get there.
Another question. Yes, in the back.
You mentioned preventative care a few times to start out with discussing the ACA. And I was wondering, I hate to ask this question because I hate the idea that you have to market kind of any type of plan that you're trying to pass or bill that you're trying to pass, but how come preventative care hasn't really been discussed in terms of what its financial impact will be in the media? Because I feel like a lot of people don't realize how much money will be saved down the road.
Well, I think it's a general point. I think that there's a lot of aspects of the Affordable Care Act that have not been really articulated well in the media. And I think one of the reasons is I think we were behind the 8 ball because the other side, the opposition, got out there. I mean, there is a TV network that's devoted 24 hours a day, 7 days a week to, spreading a lot of misinformation about the Affordable Care Act. And so we've been on the defense of that, you know what I mean? And I was actually talking to members of the faculty and Dr. Brown before that one thing that could be very helpful to us in Congress is to get the information about how the Affordable Care Act has gone into effect and its impact now. But just a side note, one challenge with prevention is that you're talking about what didn't happen. And I spent 14 years running a substance abuse prevention community organization, and we were always challenged by describing our success as what didn't happen. Just like the president is challenged by describing his success that the nation didn't collapse. You know what I mean? And because he always what he inherited versus, it's very hard to make that argument.
Dr. Wells.
Mm-hmm.
One way is, you have a lot of people in this room and in this university, USC, who have, doing lots of work on health services, health needs, including in the constituencies that you directly, are responsible for representing. So one question is, just thinking about the best way of getting information when you have information that might be useful to things and so on. So that's one way it's changed. The other is, and this is just a little reflection, about 3 weeks ago we had a health forum in South Los Angeles to talk with providers and community members. Mr. Massey was actually there from your office, with policymakers about health reform, the Medicaid waiver, and what's going to hit the ground. And what I was really overwhelmingly impressed with is everybody's just terribly confused.
Right, exactly.
Members, providers, researchers, everyone's kind of desperately sharing what piece of information and insights they have. So, one question is, how is information going to get to the ground level? One thing for us to struggle with it, but community members who have their lives to lead, and so how can we increase that transparency and sort of work together so people can make good choices for their families with all of the changes?
Well, I do think it's a big question, especially because a whole year went by with just such incredible misinformation. You know what I mean? From the death panels to this, to that. And I do think it is all of our responsibility. I'm actually experimenting with every form of communication I can from Twitter to Facebook to video conferences to telephone town halls to, because I just think it's so important that we're constant and that we're consistent. But I also think it's important that we use every single aspect of media, since there's so many ways that people receive their information now. And maybe that's something that we could, continue to work on, because I certainly don't have a magic answer. And it's even, frustrating. I was mentioning this to some people before, because oftentimes when I speak to audiences, people say, well, how come the other side is always so clear and the Democrats never seem to get their message out there? And, it's frustrating, because I think that we can be in the media every day. I do news a lot, as do a lot of other members, and but we never seem to be able to get above, the fray. But like we were talking about before, I think the opposition message is so easy because it's no. You know what I mean? It's easier. I mean, their message really is, we're always trying to explain everything, and they just, simply say government's bad, no taxes. You know what I mean?
Doris.
We've been working Healthcare for All, and many other statewide groups have been working in California for a single-payer universal coverage, and we continue doing that with SB 810 currently. But my question here has to do with waivers from the federal government. Vermont has passed a universal coverage bill, which is, I believe the governor is going to sign if he hasn't already signed it. And the question is, will they be able to get the waiver to put that into effect?
Well, Vermont?
Yes.
I don't know. But I'm sorry, I'm not sure the answer to that, because I don't know who gives the waiver.
Well, it's
That's-
a federal.
But I mean, yeah,
CMS.
right. But it's administrative. It's not legislative.
Right.
Right. It would be the Center for Medicare and Medicaid Services, which runs most of the healthcare reform program elements from on the federal side.
And so I would, right. I would think so long as we're not talking about legislation, then I don't know why it wouldn't. And Dr. Brown might know more about that specifically.
Jack.
Ties back to a question you dealt with before, pushing it a little further. As the Ryan report suggests, Republicans seem to be legislatively aggressive and ideologically vigorous. They're right out there and in many ways dominate the dialogue on a ideal level. So it seemed to me that this was not always so. The Democrats were more ideologically active, a la the Roosevelt era. So I'm curious as to why Democratic legislators, et cetera, aren't more out front than they are. And do you think that has potential to change, and how?
Well, I actually think that from the perspective of a lot of people, I'm in the 112th Congress. That's what started in January. A lot of people feel that the 111th Congress was very ideological on the part of the Democrats. And that's, when the Affordable Care Act was passed. Unfortunately, and this is something that history will show, I believe, the 111th Congress over the last couple of years really did pass a slew of legislation, very significant stuff, financial reform, healthcare reform, student education. I mean, there were a lot of things that were passed, student financial aid, a lot of things that were passed that the Republicans and actually even moderate Democrats believe the Democrats were doing kind of what the Republicans are doing this time. But I think that the nation's attention was focused on all of the misinformation around healthcare reform. So somewhere, I believe, if you're asking for my personal opinion, I think that, I consider myself an ideological person too, but when it comes to being in elected office and in the legislature, I'm a bit more pragmatic, because I think at the end of the day, what you ultimately want to do is be successful in getting something done. So my measure of what I just described to you is that the legislation that passed in the 111th Congress, with few exceptions, was passed solely with Democratic votes. So it was pretty polarized, kind of like it is now. And so I think that, you know, people who are real ideological and out there, a lot of times you alienate the other side and you're not able to be quite as effective.
And if there's a larger strategy,
Why does the other side not feel that way? Well, but you know, the interesting thing is that, I mean, I think the Republicans are really caught. I think a lot of the Republicans, frankly, are being silenced by the extreme, including the speaker. I think there's a lot of Republicans that feel that they're way too out there. But one thing that the Republicans do that's different, and I'm proud that the Democrats don't do, the Republicans threaten each other. I mean, I went through this in Sacramento during the budget wars. We have our own version of Rush Limbaugh called the John and Ken Show. And when I was speaker, you know, I was speaker for both the Democrats and the Republicans. And at different points in time, I had to protect my Republican colleagues because their lives were being threatened. If they even thought about voting for taxes, they were threatened with recalls, they were physically intimidated. So, you know, I'm kind of proud of the fact that our big tent doesn't typically allow for that kind of behavior.
yes, I'm right on the end, and then the gentleman next to you.
I work at one of the centers here at UCLA, and we deal with a lot of Medicare patients. So my question is about Medicare. Also the fact that it will be overwhelming everybody soon. So my question is, if the premium support or the voucher system would take into effect, don't you think there should be some type of regulation if we're going to be handing this voucher to private insurance providers, kind of the same what they did with the credit card market?
Well, first of all, I'm a bit more optimistic than that. I'm convinced that the voucher, and I think it's very important that we call it what it is, that the voucher will not pass. Now, you can see next week it's going to be voted on in the Senate. The Senate leader, Harry Reid, decided to put it up for a vote in the Senate. I believe it will fail. On the far out chance that it pass, President Obama will veto it, which is why I'm very concerned about the 2012 election, because although I don't think the voucher will happen at all this year, I'm going to look toward the future and be very concerned that it comes back up again.
I think on our side of the issue, I put myself in your camp, Representative Bass. When Congressman Ryan went back to his district this week, he spoke to his own constituents, and they were, at least in the videos I've seen of some of those sessions he had with them, they were verbally beating him up over his advocacy for turning Medicare into a voucher-based program and ending Medicaid as an entitlement, and the tax cuts as well. So do you think that that will actually turn against the Republicans, those kinds of proposals, and weaken their political prospects next year?
I absolutely do. And not only was he harassed at his town hall, he had to leave under police escort.
Wow.
But anyway, I do think that they've put themselves in major jeopardy, which obviously is something that I'm concerned about because I want the Democrats to take the majority back. So I like the fact that they're a little nervous right now. But I'm going to be fascinated going back on Monday because I'm going to kind of want to look at them because they all went to town halls and they all got beat up. And so I'm going to see whether, you know, how hard they're going to push this when we get back.
Yes, gentleman in the front.
Thank you, Congresswoman Bass. Good afternoon.
Oh, I'm sorry.
I guess you can say the Congress is feeling the mass strike that's hitting the planet.
Exactly.
I'd like to shift away from healthcare for now. There's another issue I actually want to address. That's the ongoing financial crisis.
Yeah.
That we're in a hyperinflationary situation now. That's the reality of it. You're seeing skyrocket. You're seeing the food prices skyrocketing. We have a galactic problem going across this globe with tornadoes, a rise in earthquakes, of greater magnitude than humanity has ever experienced. In light of all that, I bring up that this ongoing financial crisis because we're not prepared to deal with any of these things. And it has been brought to my attention by the Lyndon LaRouche Associates that there is a bill on the House floor called H.R. 1489. It's sponsored by Nancy Kaptur. It's to return to sound and to prudent banking. It basically restores Glass-Steagall. My question to you is, what are you going to do to see that this bill is actually presented to the House floor to get a vote, and what is your position on it?
Thank you.
Sure.
Ryan.
Well, first of all, I'm not familiar with the bill. And second of all, you know, in a situation, Nancy is a Democrat. And so in a situation where we're in the minority, we actually have no control over whether the bill comes up. So that's a question of Speaker Boehner and the majority leader as to whether or not a bill is allowed to come up.
Okay.
But we have no, you asked,
Okay. Thank
Right.
you. Did you have a question, ma'am?
talk to Speaker Boehner.
This woman right in front.
Hi, it's a pleasure to be here. I had
Thank you.
two questions. The first question is, how will Congress handle the federal courts and how they interpret healthcare reform? Like, what have you noticed regarding that? And number two, in California, in-home supportive services, they're facing a lot of cuts, and that's the one I'm very passionate about because there are so many people who depend on in-home supportive services, and I feel as though it's a human right problem right now, what will be occurring if those cuts are enacted. And I just wanted to know your thoughts on that.
Well, first of all, in terms of the courts, there isn't anything that I am aware of that Congress is doing specifically, but rather than letting it go through the process and feeling that ultimately it is going to be a court decision. But let's just say, for example, the Supreme Court says that, you know, basically it's focusing on the mandate, the individual mandate. And if the court says that, you know, we can't do that, that's unconstitutional, it's going to take a new Congress before we can do anything about it, because the current Congress would like for the Supreme Court to say that. In terms of in-home supportive services, that's an issue that I was involved in very intimately in Sacramento. And I also agree, I think in-home supportive services is a very, very important program. And California actually has a great example that a lot of other states don't have. But I'm glad that with Governor Brown, you know, for some reason, Schwarzenegger was obsessed with it. And I used to have to fight with him all the time because he wanted to, and actually made us pass bills that required for the patients as well as the providers to be fingerprinted. And fortunately, most of that has gotten bogged down in the courts. But I think that Brown is much more supportive, and that we're going to find that to the extent that in-home supportive services can be protected, they will with this governor.
Thank you. Yes, the woman right back there. Yes.
With Affordable Care Act, you were saying that 40% of Medicare, it goes to long-term care. And how much?
Medicaid.
Medicaid, yeah. And how much palliative care and hospice care are going to be affected with this budget cuts?
I don't know specifically about that. In terms of the overall cuts to healthcare, though, you know, again, I don't believe Ryan's plan will move forward. Otherwise, they would be very, very devastating cuts. You know, I don't think we're going to go that far. Let me just say a word about the process. The budget doesn't have to be enacted until the end of September. So all of these months, it's going to be debated. Now, you will hear shortly about the potential of a government shutdown over raising the debt ceiling. And so you know that that's separate from the actual budget. So what the actual cuts will be for the areas that you mentioned, hospice and palliative care, we're a ways away from that.
We have time for, I'm sorry, one last question in the back, and we'll see if we can broaden the discussion perhaps afterward a little bit, although I know Representative Bass has to leave pretty quickly.
One real quick question. In a conversation I've had with Speaker of the Assembly, John A. Perez, specifically regarding our efforts in healthcare for all, our grassroots organization to bring universal payer healthcare system to California. How is the administration supporting us? I know that what happens in California, because we are a bellwether state, affects the rest of the nation, and I feel that the administration should put forth a little bit of effort to try to support us here, even though the healthcare reform has been bogged down at the national level. We should at least try to make a special emphasis to try to help California get there.
I'm not sure I understand specifically how you're talking about. You're talking about the Obama administration?
Yes.
Specifically how you think that they should be helpful to California?
Yes.
In I guess, enacting or supporting single-payer legislation.
Supporting our ongoing efforts here in California.
I see what
that's
you're
his,
saying. You know, I mean, to be quite honest with you, I don't think that there's a lot of attention there on behalf of the administration. I think that they're, you know, happy that California has been supportive in trying to move forward. But one thing, and I mean, I know this from when I was working to try to get support from the administration back in the 111th Congress. In the 112th Congress, it's very little that can be done. And so I do know that the administration is completely bogged down. And Speaker Perez and also Darrell Steinberg, I would love to be as supportive as I can to them in terms of bringing resources to California, but I don't think it's going to happen.
I'm sorry, I know several of you still have questions, and I think we've run out of time. I want to thank Representative Bass very much for joining us, sharing your information. And to thank you very much for leading the struggle on behalf of California in Washington.